Hi, I'm Claire and I'm a pelvic health physiotherapist, and today I'm going to talk to you about diastasis recti. Diastasis recti is the gradual separation of your six-pack muscles, which is still there during pregnancy even if you don't think they are. The linea alba, which is the connective tissue between, gradually stretches as well. And this is completely normal and necessary so that your baby can grow. Studies have shown that 100% of women will have some element of diastasis by the end of pregnancy. So if you're noticing that during pregnancy there is a bulging down the middle of your tummy, don't worry, you're not alone. I'm sure everyone else you know who's pregnant will also have the same. But it's about protection. And postnatally, it's about how we help you in your recovery. But you're not broken. You can still move, but there's things that we can do to help. What we're going to demonstrate with Lulu here, modeling for us, is what a diastasis can look like. Now, it's generally different for everyone, so please don't compare yourself. Lulu here is a mum of 2, and her youngest is now 11 months. Between her 2 children, she had an umbilical hernia repair as well, so she has got some scar tissue which influences her tummy. And that just shows how individual it is for everyone. She's come a long way in her recovery, and we're still working together to improve it. But we want to show you what you might notice and things that you can look out for in your own tummy. So what I'm going to ask Lulu to do now is to lift her head and shoulders. And what we're looking for is just in the middle of the tummy here, she has a slight rise. Now this is very, very mild. Some people will have more and some people have less. But what you'll notice is that I can fit 2 fingers still between the borders of her six-pack muscles. So this is one side and this is the other. So she still has a 2-finger separation between her muscles, and Lulu can relax down. However, she can still exercise to a very high level, and you'll see her in the postnatal plan exercising you and leading you through exercise. So it doesn't stop her. She has what we would call a functional diastasis. And when she engages her deep core correctly, she's able to maintain any intra-abdominal pressure. Because what we're seeing here when she has a bulge is that the pressure in her tummy is pushing out on that connective tissue, and that's why you're getting a bulge. For some women though, they won't see a bulge. They might actually see the tissues moving inwards. So more like a trough. So that might be you. So don't think you will look exactly like Lulu, because it might look slightly different. So the main thing to concentrate on is not how big your gap is, but actually what the connective tissue is doing between it. So as we've said, we don't want it doming, we don't want it dropping down, we want a nice tension. So you can always try and have a feel of your tummy yourself, but just remember, you're not trying to focus on the width, you're trying to focus on how strong it feels between. So Lulu's going to try and check her in diastasis here. So she's just going to place fingers just above her belly button, and as you can see, she can still fit 2 fingers, but it feels nice and tense. So she can't sink down really deeply. It's much better to have a 2-finger gap with some tension than 1 finger, but you can actually descend quite far into the tummy. If you're noticing any of this, it's very difficult to give generalized exercise for anyone's diastasis because every single person's different, and there are more factors in play than just how long your tummy muscles are and how wide there are. It's about how you breathe, other factors in your life, how you're carrying. So our best recommendation is that you get individualized help from a pelvic health physiotherapist. Speak to your GP or try and find one privately. There are some exercises that are really good for general rehab, which we are going to show you. But for high level work, we recommend that you get some help if you're noticing any of these ongoing symptoms that we have talked about. We're going to teach you now a few exercises that for most women will help them with diastasis recovery. We need to say that it won't be for everyone, and if you do these exercises and notice any doming in the middle of the tummy, any of it dropping down, or any symptoms that you're not sure about, please don't continue. So the first exercise that we're going to go through is Lulu's going to try and work on her pelvic floor and deep abdominal connection. So the transverse abdominis. There's another video about this, so if you want to know more in-depth information, please check it out. So what we're going to get Lulu to do now is with a nice breath in, and then as she relaxes that breath out, she's going to think about holding wind and holding urine to engage her pelvic floor, and then drawing 2 magnets together between her pelvis, and then let it all go. And as you can see, her tummy's not bulging, so we know for Lulu this is a really good exercise. And this will be the foundation of all the other exercises that she does. So just to recap, with your pelvic floor, you're thinking about holding wind, then holding urine. And for your deep abdominals, you're thinking about a magnet on either side of the pelvis and that they're drawing together. So just try that once more, Lulu. Breath in, keep everything relaxed on the breath in. As you exhale, the breath goes out gently and you think about holding wind, holding urine, and those magnets coming together. So you'll notice it's not a big movement of her tummy, it's not a big workout, but it's setting her up for the rest of the exercises. This next exercise is called knee fallouts. Lulu's still going to do her pelvic floor and deep core activation, but now this knee is going to slowly go away from the body. The focus here is the pelvis. So what we don't want is where the knee's not moving for this pelvis to be lifting off the mat. So initially, you may just be able to do a tiny little movement before you feel it lifting, and then you'll need to bring it back. What you want to be feeling is a gentle tightening here in the lower tummy. But again, not too much work, higher up. The next exercise is called leg slide. So again, pelvic floor, deep activation of the tummy, and Lulu's going to take one foot, heel sliding along the floor, and bringing it back up. Now the focus here is not what the leg's doing, but actually what's going on at the tummy. So Lulu's now making sure she's using her tummy to control and not allowing her back to lift up off the mat. She's keeping everything very still here. So again, in the initial weeks of trying this, you may only be able to take your leg halfway, which Lulu's going to demonstrate now, before bringing it back. That may be enough work for you, and that's absolutely fine. The next exercise is called rib closure. Your ribs play a huge part in abdominal recovery. They're the top where the muscles attach. So postnatally, they can really flare. You can't see this on Lulu now because she's done a lot of work on this, but actually your ribs can almost sit upwards. So what we're going to try is arms by the side. Again, pelvic floor and deep abdominals for each exercise. And on the exhale, Lulu's going to take her arms up towards over her head. Now, you can see here she's actually having to use her muscles to control her ribs so that her rib cage is not lifting up off the mat. So again, in the early weeks, for some, you may only have to bring your arms to just about here before you start feeling that your rib cage, and we're just going to demonstrate that, lifts up. We don't want to see that. So keep it nice, melted down onto the mat, and just work your arms in the range of movement that you feel you can control. The next exercise is a shoulder bridge. So keeping your muscles strong in your bottom postnatally really helps with posture, and that also helps with diastasis recovery. So what Lulu's going to demonstrate now is, again, she's always going to use her pelvic floor and her deep abdominals. She's going to tilt the pelvis slightly back, push through her heels, and lift up. Again, what we're looking for is that she doesn't lift her ribs too high. So everything doesn't, if you lift up, we don't want you up here, okay? And that can feel very natural postnatally. So we're just going to work in a small movement, up you come, keeping the control here, and dropping it back down, slowly, slowly. So you're thinking about the ribs being relaxed, you're thinking about the engagement in your tummy, and you're pushing through your heels. So you should feel this working in your bottom and in your tummy. For each of these exercises, we recommend that you start with about 8 to 10 reps. And you can do these a couple of times a day, maybe while your baby's playing on the mat. But the focus needs to be about the quality of the movement. So if you do 2 and you're not sure if you're able to maintain your activation, or you're not quite sure if you've got the right control, please stop and restart, or try again later. For more exercises like this, please head over to the Fiit app for the Postnatal Plan. The initial stages include a lot of Pilates with similar exercises like this, which are designed to help you improve the connection with your tummy and help with diastasis recovery.